All right. Welcome, everyone. Good afternoon. I'm Anna Kennedy, and welcome to our first self-care check-in for helping professionals. I'm the executive director of LOHF, and we work to improve children's mental health here in Lancaster County. We're excited that you're here to join us, and welcome. So our intention with this series, this is our first weekly series, and we want to provide a space for us to learn and connect as helping professionals during this COVID-19 pandemic. So each week we will welcome a guest who can share their insights on self-care for all of us to learn together. And so we ask for your patience with us as we navigate this new series together and try something new. And we want to thank you for tuning in. So before I introduce our host, I want to just do some quick housekeeping items. We are recording this session so that you can revisit the content at a later time, and also so that you can share this with your colleagues or anyone who is interested and can't attend today. We ask that you please keep your mic muted, and we welcome you to also to turn off your video sharing if you'd like to just relax and sit back and listen to the conversation. You're welcome to do that. We also want to invite you to type your questions into the chat box, and we have shared a resource that we want to bring to you. There's the support group for helping professionals that is being started this week for a 4-week series, and it's free and open, and that is available now in the chat. So again, just a reminder that we're recording today's session so that you can revisit the conversation at a later date. And thank you for joining us. We really appreciate your interest in this topic. We've just been really pleased with the response, and we hope that the content is very valuable, as I'm sure it will be. So now I'd like to introduce and welcome John Walker as our host for today. He is founder and principal of J. Walker Marketing, and John is a digital marketing expert, and he also serves on the LOHF board, most recently as chair. So thank you, John, for serving as our host, and I'm going to turn it over to you.
Thanks, Anna. I appreciate it. Like you, I'm spending a lot of time in this room where you see me. You know, like people across our community and around the country and around the world, we're in very challenging times. And I think all of us are trying to find ways to keep our spirits up and adjust to this really strange environment. And it's a challenge to our emotional health. And it can be especially challenging for people in the helping professions who are not only carrying the burden of their own health, but trying to help others and taking on some of the burden of others who have very challenging situations as well. So I am really excited to have the chance today to talk with my friend and fellow board member, Adam Biuckians. Adam is a psychiatrist. He's medical director at Community Services Group in Lancaster. And this year, he's also become our board chair at Lancaster Osteopathic Health Foundation. So we're very pleased to have Adam here. Welcome, Adam.
Thank you, John. It's a pleasure to be here.
Let me start by asking you about, you know, what kinds of strain and stress are you seeing people facing, especially those in the helping professions?
Yeah, we are definitely in unique times with this pandemic. And I will say that in my lifetime, I don't remember anything quite like this, as I'm sure most of us don't really remember quite anything like this. Probably the most unique thing about this whole situation, you know, compared to other disasters or emergencies that society has had in my lifetime, is that there is a genuine fear of, infection, and then what becomes of that infection. Specifically, I think that there's an underlying fear and anxiety related to dying because of this infection, and also passing this infection on to our loved ones who might be even more at risk of dying. And in order to combat that and mitigate the spread of this illness, we have, as a society, developed this, I don't know exactly what to call it, like policy of isolation and social distancing, where we all have agreed to kind of stay away from each other. And while that is, really good at reducing the rate of infection and preventing the spread of this, the downside of such an approach is that it can potentially lead to genuine isolation from each other, and that can lead to feelings of loneliness. And we know in the last 10, 15 years even that loneliness is a real factor in how people respond to their own physical health, and we know that loneliness is a barrier and a risk factor for poor outcomes when it comes to, really any kind of medical ailments, infection included. Mankind is hardwired for social contact, and we know that through our research that loneliness or lack of social contact is actually processed in the same centers of the brain as physical pain. And what we can take from that is we know that personal contact is precious to nearly everyone. So in this time of social distancing, we have to recognize that being away from our usual social contacts, can truly be a detrimental and painful experience for us that we need to attend to. Additionally, all the social distancing is a huge disruption to our normal daily routines. We don't get to spend time with the people that we care about outside of our immediate family. There's no going to movies or shows. There's no going out to a restaurant and have dinner with a friend. There's no going out shopping with friends. And for our kids, there's no school, which is the main social outlet for them. And a lot of extracurricular activities have fallen by the wayside, especially sports. So there's a lot of stress and anxiety that goes along with all of that. Additionally, there's also fear of job loss, whether that's fearing that you're going to lose your job or you've actually lost your job and all the stress that's related to that financially. May not be so much of an issue on the healthcare end, but what stress there is actually has to do with the way we are delivering and providing care. It is different than it was 2 months ago, where telehealth, was kind of a minor part of the overall healthcare delivery system. It has exploded to become almost, 90 to maybe even close to 100% of the way outpatient care is delivered at this point. And so you have lots of providers who had never done telehealth in the past having to go through the stress and anxiety of, learning how to use the technology and the equipment to provide telehealth, get used to actually interacting with people on a regular basis in a therapeutic way via telehealth. And related to that is with telehealth and with social distancing, there's now a lot of people working from home that did not used to work from home. And so that's a big adjustment. And then on top of that, especially the parents who are working from home that have kids who are home from school, they are now trying to balance a home work, life balance, where they're having to work from home and have their own space there. They're having to proctor their kids' homeschooling packets, all that kind of stuff. So there's a lot of stress and anxiety and frustration, that is created by all of this that, is quite unique to the situation. And then finally, maybe the biggest fear of all of this is the fear of the unknown. Even though there is a constant flow of information from the media, there's a general lack of clarity about what is going to happen, even within the next week or two, let alone what's going to happen months from now. And that is probably one of the biggest stress anxiety producing situations that we are in at this point. And one final comment about it is that, when you combine that fear of uncertainty and the fact that we are isolated from each other and it is more difficult for us to kind of lean on each other and support each other, it really creates a scenario where we're all under amazing amounts of stress.
Wow. Well, I mean, what you're describing is kind of a perfect storm of of stress and anxiety. Extremely
Yeah,
challenging.
that's a great way to describe it. I think a perfect storm of factors that we have not faced, as far as I'm aware, in our lifetime.
Mm-hmm. So what's this may sound like an obvious question, but why do we need to pay attention to this, particularly in the helping professions? And what's the risk if we don't pay attention to it?
Yeah, great question. Well, I think the primary answer to that question is, if we don't attend to these and pay attention to all this stress and anxiety that we're all experiencing, we're at high risk of burnout. And burnout is, it's not just a colloquial term, but it is a genuine clinical entity that's been described in the literature for many, many years. There was lots of research and study in the late 70s and early 80s about this concept of burnout, particularly in the healthcare field. And it's something that we need to prevent, because burnout has been shown to have lots of detrimental consequences, not just for the person themselves who is experiencing burnout, but for the patients that they are caring for. There have been numbers of studies. For example, there was a study looking at medical errors committed by surgeons, correlating that the number of medical errors that they made was directly related to the amount of or degree of burnout that they were describing for themselves. There was another study looking at nurses, and nurses that reported higher levels of burnout. They were shown that they were more likely to be involved in cases where there was patient mortality, and also in dissemination of hospital-transmitted infections. Another study looked at medical students, and those that reported burnout also had links to more dishonest clinical behaviors, a decreased sense of altruism or feeling like you're doing something good, and alcohol abuse. And high rates of physician burnout also correlate with lower patient satisfaction ratings. And the bottom line of it all is that it's quite clear that when the workforce is experiencing burnout, the clinical care that is provided is less than ideal, is kind of the takeaway from that. And at an even higher level, at an institutional level, what happens with burnout is that it results in greater job turnover, and the workforce itself has increased thoughts of quitting. It results in decreased workforce efficiency. In fact, there was a study by the Mayo Clinic that estimated that the loss of productivity due to physician burnout in this study was about the equivalent of if you just eliminated 7 entire medical school graduating classes. And when we know already that there is already a healthcare workforce shortage, burnout is only going to exacerbate that at a time when we absolutely need to bolster our workforce and not burn it out.
So I hear you saying that people in the helping professions not only owe it to themselves, really, to take care of their own mental and emotional health, but that on a community level, we really need those people to be at their best because we need their services so urgently now. Is that fair to say?
That is absolutely a fair statement, and I couldn't have said it better.
So how do we approach dealing with the added strain of this situation? I mean, one of the things that I keep thinking about is at a time when each of us needs social contact to feel okay and to serve as some sort of salve to the stress that we're feeling, we're in a situation where we really have trouble getting that social contact. So how do we deal with that situation? And how do people in the helping professions do other things that enable them to take care of themselves?
Yeah, so I would tell you that people in the helping professions are really no different than, you know, people in other professions. We all, again, we are hardwired social creatures, and so I will harp on this over and over again. But one of the best things that we can do is reach out to our social networks in whatever way that we can. You know, we have technology now that it's amazing to me when I stop and think about it, you know, even compared to when I was a kid. But the fact that we could even do this, we can have a video conferencing call with, you know, 50, 60 people. You know, we can interact, exchange ideas, support each other, questions and answers, that kind of thing. We need to continue to do that on a regular basis with each other. We need to do it, you know, with our close family and friends, you know, especially because we do not have the normal social outlets or ability to have our normal social outlets like we did before, where we could meet in person and do activities and such. But we need to stay connected with each other.
That makes a lot of sense. I want to remind the group that we're going to have time for a few questions here, and you can type them into the chat box, which is in the bar at the bottom of your screen. And I know Anna has put a couple of resources in there. So while we continue chatting here, please enter your questions and we'll pull up a few of them and answer those. But Adam, what types of, you know, it's hard to know how long this challenging situation is going to last. And I imagine that's another thing contributing to all of our stress. You know, you'd like to know, okay, how long do we live in this state? And we don't know. What types of changes do you recommend that we make now? And do you think that maybe we make going forward, even as this thing starts to wind down a little bit?
Yeah, well, I would tell you that I think one of the most important things that we can do, in addition to maintaining our social context, is to keep some semblance of routine, you know, with regards to what our stress relievers were, you know, before this pandemic, and to maintain good health habits as well. You know, so I would advise kind of you know, the routine things that, you know, physicians always tell their patients to do: eat well, exercise, you know, practice mindfulness techniques, calm yourself. You know, and we can go through a couple of concrete examples of those kinds of things. But taking care of yourself and your well-being is vital if you are going to maintain yourself in a way that you're going to be able to continue to take care of your clients and your patients. You know, some things that I would advise that we do, especially in this situation where we are realizing that this is not going to be a short-term situation that we're in, even as we gradually reopen. It's going to be quite some time, it appears, before we get back to anything that resembles a sense of the normal that existed before all of this happened. So we need to pace ourselves. You know, this is truly going to be a marathon and not a sprint. So we need to take care of ourselves. And if we overwork ourselves or try to do too much too quickly or overstress ourselves with things, we're going to become less effective at helping those that we want to help.
That makes sense. You know, one of the things, while we're talking about the chat, that I'd be interested in hearing from the group, are there those in the group that have found ways of using routine as kind of a framework or a stabilizer? And also, you know, what are some ideas that people are using to stay in touch with others during this time? And while we look for responses to that, Adam, let me ask you another question. So, you know, many of us have kids, some may have kids at home. And I wonder what your thoughts are relating to any particular challenges that kids may be facing and perhaps that parents might be facing.
Yeah, sure. Great question. So generally, I will tell you that kids are a very resilient bunch. And I say that just because there might be a tendency to over worry about, how kids are faring with all of this. I think the majority of kids are actually finding this kind of, not necessarily paradoxically, but interestingly, it might actually be a good time for them. They're actually spending more time now with their family. And I think maybe one of the silver linings with all of this is that with there being more time with family now, we can take that opportunity and build even stronger relationships, with our kids. But that said, kids, understandably will have anxieties just like, the adults do about this whole situation. And it is important to talk open and honestly with your kids about it. Obviously, at an appropriate developmental level, the way you're going to talk about it with a 5-year-old is much different than the way you're going to talk about it with a 15-year-old. Kids generally take their cues of how to respond to situations from their parents. And so the way that you as a parent are responding to things, the kids are going to see that and respond very similarly. So you do want to approach any conversations that you have with your kids about this situation in as calm and in control way as possible. And that's going to go a long way to making sure that your kids also respond to this situation in as healthy a manner as possible.
That makes a lot of sense. And I'm seeing some really great ideas rolling up here in the chat. Let me just read a couple of them. So one is using Zoom calls with your family. Another is church services that are available on Zoom. Taking nice walks. And I know that getting out in nature is a real joy for me. That's probably my secret medicine here. Mm-hmm. Someone said that the Headspace meditation mobile app is offering free subscriptions for 1 year to providers with a NPI number. So for those who are interested in meditation, Headspace can be a great resource. Someone else said managing a schedule of family dinners. Someone else said Words with Friends apps. Mm-hmm. I've finally broken my addiction to that, but maybe I'll have to get back to it.
Yeah, that's funny. Like you, John, I used to play Words with Friends a lot too. I haven't in a while, but yeah, maybe I'll pick it up again.
Yeah.
Or similar apps. There's lots of those kinds of game apps.
Sure. And the last comment here, trying to maintain regular bedtime and wake up times.
Absolutely.
Yeah.
Oh my gosh. I talk about that all the time with my patients and families, what we call sleep hygiene. And I did not mention that, I don't think, in my comments today, but getting regular sleep is one of the most important things that we can do. In addition, to kind of the obvious things of being well rested and being refreshed for the next day, we also know that sleep is vitally important to the functioning of the immune system. Lots of research shows that when you're sleep deprived, your immune system is not functioning at its best, and it actually puts you at increased risk of infection and not being able to fight off that infection. So sleep is vital.
Very good. That makes a lot of sense. And I imagine that there's a relationship between exercise and sleep. Obviously, it can be easier to sleep if you're staying active. So I imagine that's related as well.
Absolutely related. And exercise, by the way, is also one of the best things that you can do to maintain good emotional regulation. Lots of studies show that exercise is very good for mental health in addition to physical health. So whatever your preferred physical activity is, whether it's walking, running, aerobics, or yoga, I mean, whatever, it doesn't matter. As long as you're getting out there and moving, that's going to go a long way to helping reduce your overall stress level.
Okay. I think we're about 5 minutes to the end. I just want to share two more things that I'm seeing here in chat. One is gratitude for little things, no matter how small. I really like that one. Someone else said, I've been having virtual coffee dates with friends.
Yeah, that's a good one.
Yeah.
Also, I didn't hear this, but I'll throw it out there. There have also, I know a lot of workplaces, including at my work here at Community Services Group, they hold virtual happy hours.
Okay.
So I think that's another good way, to kind of maintain social connections with those at work, especially because a lot of us are working from home now too.
Sure, sure. Well, Adam, this has been absolutely fantastic, and it's great to hear from an authority like you at a time like this. And I found your insight invaluable.
Thank you. It was a pleasure to do this. I look forward to the recurrence of this happening on a weekly basis. And I really do hope that, maybe in the future we can get, more audience participation. I know we're participating in the group chat, but maybe more. I know we had a dialogue today, but I think it would be helpful to, have everybody, kind of talking with each other as well. So if we can figure out a way to make that happen in a non-chaotic kind of a way, I think it'd be great.
Sure, sure. Great. Well, thanks again. And let me turn it over to Anna, because I think, Anna, you're going to do a little exercise at the end here.
Yeah, thanks, John. And thank you, Adam. Again, that was fantastic. So I'd like to just close us out with a self-care practice, a simple technique that many of you probably know, but I thought it would be good to practice it here together as we close out our time today. This is called the 5 senses grounding technique. And so if you are familiar with this one, we thought it'd be a good one to close with. So this is an especially helpful activity to help us focus on the present moment and to help us tune into our surroundings a little bit more. I find it very helpful to calm any racing thoughts or to really bring myself back to the present moment instead of thinking about the future so much. So to do this, we'll just get started in a seated position, which you probably already are. You want to put your feet on the floor and rest your hands in your lap. And we'll do this silently. So it might be helpful to start with your eyes closed. And we're going to take a few slow, deep breaths together. So we're going to go in through the nose for the count of 3. And out through your mouth for the count of 3. You can do that a few more times. One last time. All right, and then silently to yourself, you just want to name 5 things that you can see right now. Your eyes open. Identify 5 things that you can see. And then 4 things that you can feel or touch. Maybe it's your feet on the floor, back resting against the chair. 4 things that you can feel. 3 things that you can hear. 2 things that you can smell. If you can't smell anything, just think of 2 nice things that you like to smell. Coffee or chocolate. And finally, 1 thing that you can taste. And if you can't taste anything, something you like to taste or eat. And then you can just take a few more calming breaths. So this is the 5 senses grounding technique. You might want to just check in with your heart rate and see if your heart rate is lowered just a bit after doing that activity. I usually find that I'm a little bit calmer, and it only took a minute. So this is something you can do in between meetings, in between phone calls. It's silent, so you can practice it on your own without anyone knowing that you're doing it. And hopefully it's helpful, and it might be something that you already have in your practice, but can be just a wonderful reminder to do this. So we wanted to leave you with that today as a good self-care practice, to remember that self-care is not selfish. It's very important, as we heard from Adam. So we hope that this time together has been valuable self-care for you, helpful reminders. We want to just remind you that we did put a free support group resource in the chat. So it's there for you. I'll share it again so that it's at the right there. And we want to thank you for the work that you do every day in our community. We really appreciate all the work that you do now more than ever, and just thank you so much for participating. I do just want to let you know that next Monday, our guest will be Melanie Snyder, and she will share her expertise on self-care, trauma, and resilience. Melanie is the Trauma and Resilience Specialist at Penn Medicine Lancaster General Health, and she's a wonderful leader in this work, and I'm pleased that she'll be joining us next Monday. And thank you again. Thank you to Adam and John, and for everyone for joining us.
Take care, everyone.
Bye-bye, everybody.
Thank you.